The U.S. Centers for Disease Control have a new report out that says the number of drug-resistant bacteria in America is on the rise, but the source of these microbes is what's most surprising. Arise News medical contributor Dr. Aletha Maybank is here with more on that and other medical news. Hey, it's always good to see you.
Hello, good afternoon.
Okay, so we've been reporting in the news for a little while now that there's a growing number of antibiotic-resistant bacteria. So what's a surprise here is the source.
Right, well, you're right, and we've heard a lot about this in the news, and this is really the first report that's really focused on the threat of antibiotic-resistant bacteria. Now, there are two main systems within our country that have been responsible for it: the healthcare system and our food system. And they've been known, but I think that to the degree of which we've kind of put responsibility on has changed and varied. And, some people want to take responsibility, some people don't. But really what we know is that over 2 million people get resistant infections from these bacteria. About 23,000 die per year, which is a pretty large number. The main deaths and most of the deaths are happening within the hospital system. However, I think what's important and what this report really shows is that both systems are responsible, and they interact very much so. As a person, you get infection, you get in the hospital. The issue with antibiotics, they're great, and they've done some great things for us as a community. However, they kill off all bacteria, whether it's good or bad. And you have this opportunity for resistance to develop. And we know historically within the healthcare system that there has been misuse and abuse of antibiotics. And so it's created a system. Within the food system, the same thing. Animals have been given antibiotics for a good purpose, in a sense, at least the intention of it, but they're given way too many antibiotics. And then when they interact, the human system and the animal system, then chaos can kind of happen. And really this report is saying, this is happening and we need to act on it.
No, I was just going to say, and I believe there has been a profession-wide push to decrease the amout of antibiotics that are prescribed.
Absolutely.
And I do remember, because I have a young child, the American Association of Pediatrics came out, with saying don't prescribe as many. If you don't think it's a bacteria, then don't give them anything at all. Are doctors adhering to this? Are you really seeing the trend of lower prescription rates for antibiotics, no matter, what the snuffiness?
Right. Yes, you do across the board. As a pediatrician, it was the guidance that we were given. And I was in residency kind of at this height and this awareness on the provider side that we need to decrease the amount of antibiotics that we're prescribing kids. If they have a runny nose or a cold, let's wait and see what happens. But I do think a lot of physicians now are really taking that on. But there's always, more and more that we can always be doing, even with guidelines in place.
Absolutely, because this is so important. Because if there gets some sort of super infection, and there are some out there that we can't treat.
Right, and that's what this action, the report is calling upon, that we may need different antibiotics and newer antibiotics at this point.
Yeah, absolutely. Okay, let's turn the corner and talk about something that's very, very important, and that is the marketing of food. Yes. The First Lady has joined this campaign. Tell us about the campaign and what she wants to accomplish.
Right, so this is the next phase of Let's Move, and it's the first time that the White House actually convened all different people from different industries to talk about food marketing. Initially it was more so let's increase access to fruits and vegetables, let's exercise, but now she's boldly taking the industry on and saying, thank you for all the changes that you've made. We know that childhood obesity has decreased in cities like New York City and Philadelphia, which is great. However, we still know that 1 in 3 kids are still at risk for getting diabetes, and that all of these messages that they see, and they are bombarded. We know that 86% of the content is really of the ads that they see are poor nutritional content, and they get about 1 ad per week of healthy food. So she's saying, as an industry, you're very powerful. Your marketing is very powerful. Can we kind of do some more powerful ads that are related to healthy foods? And kids sit in front of the TV for 8 hours a day.
Mm-hmm. Well, good luck with that. It's an uphill battle because if you watch any television, particularly on a Saturday morning, it's one fast food after one sugary cereal after one different kind of candy commercial that comes on during all these cartoons that kids watch. So it's just I don't know.
It is an uphill battle, but I think it's also to help parents be aware that I think sometimes we're not quite aware of what's going on and what our children are looking, how powerful it is. I mean, as a parent, they call it pester power. Mm-hmm. Of when you get nagged about, oh, Mom, can I have this? Dad, can I have this? And it really comes from marketing, and marketers know that very well. So if we can kind of switch that and flip that, it'd be really helpful.
All right, very quickly, describe what the plate should look like. When I was growing up, it was the food pyramid, but that's changed. So what should our plate distribution look like?
So 2 years ago, the USDA got rid of the food plate. In the news yesterday, University of New Hampshire actually on their college inserted what they call My Plate. So at myplate.gov, it's really to help, and I think it's a clearer guidance on how much you should be eating and what types of food you should be eating. So your plate should be no more than 7 inches if you're a child, no more than 9 inches across. If you've noticed when you purchase them, they're wider and wider and wider, too much food. Half of the plate should be of fruits and vegetables. Half, quarter of a protein or meat, if you eat meat, or some source of protein, and then the other quarter, like a carbohydrate or rice, a potato, whatever it is, the grains of that sort, right? That's what your plate should really look like. And I think, congratulations to University of New Hampshire for doing something that's a little bit novel. Will all students change their plates? I was reading, that some were still piling on, fried chicken wings, on the plate. However, some of them were being a little bit more conscious. So there hasn't been any study or evidence if this is going to be effective or not. But I think it is another opportunity to have options and to make choices that are healthy.
Right, reinforce those good lifestyle choices very, very quickly, because we're really about out of time.
Sure.
It seems that anti-smoking campaigns are working.
Yes, well, power of marketing again, right? And social marketing. CDC, they launched a campaign in March 2012 of very graphic ads. They had done them in New York City a while ago, but a hole in the throat and a lot of smokers where they have these long-term effects that are really harmful to the body. And what these ads do, I think that really hits us hard, is we value the quality of life. And when we see that quality of life is going to be taken away, people were acting and reacted. So over 1 million, I think 1.5 million people actually access the quit line, and then 100,000 actually permanently quit smoking from seeing those ads. So
that
completely
is some
powerful.
Good news. Aletha Maybank, thank you very much.
You're very welcome.
All right, see you next week.
Okay, thanks.